Hello, everyone. This is Dr. David. You can call me Margarita. Yesterday, the World Health Organization labeled the COVID-19 virus as a pandemic. It is so important for you to understand what the difference between a pandemic, epidemic, and endemic is. So make sure you watch the following video presentation. On March 11th, 2020, the World Health Organization has declared the COVID-19 outbreak to be a pandemic. It is very important to understand what does that mean. First, you must understand what an endemic is. An endemic is a disease that exists permanently in a particular region or population. For example, malaria is a constant worry in many parts of Africa, so this is considered an endemic. An epidemic is an outbreak of disease that attacks many people at about the same time, and it can also spread through one or several communities. For example, prior to March 11th, 2020, COVID-19 was considered an epidemic. However, the World Health Organization declared COVID-19 as an pandemic, which means this is when an epidemic spreads throughout the world. So it's not only attacking certain people in certain communities, it's going worldwide. Therefore, it is so important for you to understand what a pandemic is. When the World Health Organization declares a pandemic, it has nothing to do with changes to the characteristics of a disease, but it is instead associated with concerns over its geographic spread. According to the World Health Organization, a pandemic is declared when a new disease for which people do not have immunity spreads around the world beyond expectations. So, how does the World Health Organization decide whether to call it a pandemic? Cases that involve travelers who have been affected in a foreign country and have then returned to their home country, or who have been infected by that traveler, known as the index case, quote unquote, do not count towards declaring a pandemic. There needs to be a second wave of infection from person to person throughout the community. Once a pandemic is declared, it becomes more likely that community spread will eventually happen, and governments and health systems need to ensure they are prepared for that. An epidemic, on the other hand, is a sudden increase in cases of an illness or disease that can be unique to one country or community. As the COVID-19 virus has been labeled a pandemic, you need to understand, and this is something that the WHO Director General, Dr. G, mentioned in a media brief on March 11th, 2020. This is not just a public health crisis, it is a crisis that will touch every sector. As a result of 118,000 cases of the coronavirus illness in over 110 countries and territories around the world, a pandemic was labeled. As of March 11th, 2020, there are a total of 4,262 total deaths worldwide, which in the US alone, there are currently over 1,260 total cases with approximately 40 deaths. Now, the CDC says it's used when viruses are able to infect people easily and spread from person to person in an efficient and sustained way in multiple regions. However, you must understand that the word pandemic refers to the spread of a disease rather than the severity of the illness it causes. What should we do in order to prevent the spread of COVID-19? Make sure that you look at my previous video titled COVID-19 What You Need to Know, and I will make sure to tag it in this video so that you can have a really good sense of what COVID-19 is, its 3 different phases of symptoms, and also we review the same prevention strategies that are right here. So the number one thing that you should be doing is proper hand washing techniques. Make sure you're washing your hands with soap and water, and if that is not readily available, make sure you're using a 60% alcohol-based hand sanitizer. And remember that when you're washing your hands, make sure you're scrubbing them. Also, stay away from the T-zone of your face. This includes your eyes, your nose, and your mouth. Bacteria, germs love to travel to those places, so do not touch your eyes, nose, or mouth. Avoid travel to high risk areas. And also make sure, very important, that you're covering your coughs and your sneezes with your elbow flex. Now, if you're using a tissue or handkerchief to cover your coughs and sneezes, make sure you're discarding that tissue and that handkerchief is washed in hot water prior to continuous use. Also, make sure that you are disinfecting surfaces. Remember that respiratory viruses are usually transmitted via droplets in sneezes or coughs of those that are infected, and they can travel up to 3 feet or 1 meter. And also, guys, they can survive on surfaces for over 24 hours. Now, the CDC, or Center for Disease Control, want you to keep not only standard precautions, but also airborne precautions, droplet precautions, and contact precautions. So make sure that you are following and that you know the COVID-19 policies and protocols of your healthcare facility. Now, should you wear a mask or not? That is the common question. It has been found that a mask does not prevent those that are not likely to get COVID-19 from getting the virus. However, if you work in a healthcare facility where there are patients that are at high risk of getting COVID-19 or that already were diagnosed with COVID-19 virus, you have to make sure you take the proper precautions. And because the Center for Disease Control has recommended the use of airborne, droplet, and contact in addition to your standard precautions, this will include wearing an N95 mask, as well as the proper isolation gown and gloves. And if you are dealing with secretions, for example, when you have a trach patient that has a tracheostomy and you need to perform suction or do trach care, you should always be wearing eye shields. Make sure that you're looking at the following slides that show you how to properly place your PPE as well as take them off. Those steps are crucial in order to prevent yourself from getting contaminated with a patient that is either probably positive for the COVID-19 or being tested in order to be ruled out. Also, make sure that if you are sick, that you stay home and that you thoroughly cook your meat and eggs prior to consumption, as COVID-19 can live in uncooked meat and eggs or any uncooked animal product for up to 70 degrees Celsius. It is also very important that you prepare for a potential outbreak, and this can entail having everything shut down, which includes supermarkets, pharmacies. So make sure that you have what you need in your home in order to survive at least 2 weeks without leaving your home. Being that the COVID-19 virus originated in Wuhan, China, here's a fun mnemonic for you to remember in order to prevent the spread of this virus. 1. Wash your hands often. That is the W for Wuhan. U. Use your mask properly and when necessary. H. Have your temperature taken regularly, especially if you've traveled in those high risk areas. A. Avoid large crowds and stay home if you are sick. And N. Never, ever, ever, ever touch your face with your unclean hands. Remember, hand washing is vital to stop the spread of COVID-19 virus. So make sure you're scrubbing those hands with soap and water, and if it is not readily available, that you use a 60% alcohol-based sanitizer in order to clean your hands. Well, I hope that this video was of use to you. Make sure you go to drregisterednurse.com and look out for that quiz regarding what a pandemic is. And also remember, there's a bunch of NCLEX quizzes on there, as well as the regular quizzes that are attached basically to the YouTube videos that I have done for you. Make sure to subscribe, like, and share to this channel, and put your comments below or any questions that you may have. I do look through them and I try to answer as many as I can. Well, I wish you a great rest of your week. Make sure you wash those hands and make sure you take all those safety precautions in order to prevent the spread of COVID-19. See you soon, quote unquote. Have a blessed rest of your week. Bye.